হ্যালো হ্যালো আমার কথা ক্লিয়ারলি শোনা যাচ্ছে? ওকে। Assalamu alaikum. I would like to welcome you all to the Mujib 100th Industrial Exhibition. It's an honor to have so many distinguished guests in this wonderful event. This session is a hybrid one, so we will be connected with people via Zoom platform and also in person in the Harmony Hall. We are gathered here today to talk about the digital health inclusion to achieve universal health coverage in the fourth industrial revolution. To talk about this important issue in depth, we are delighted to have Professor Khondokar A. Mamun sir as the guest speaker. Hello. Okay. So, as I said, we are delighted to have Professor Khondokar A. Mamun sir as the guest speaker of the event. Sir will elaborate more on this topic. Sir will elaborate this event. We have I would like to request Mamun sir to take over the session. Thank you.
ঠিক আছে ওকে হ্যাঁ সেমিনার শুরু হচ্ছে হ্যাঁ হ্যাঁ জি আসসালামু আলাইকুম জি বসেন ওকে very good morning to everyone. So this is Professor Mamun, and thank you so much moderators for the good introductions. So I'm going to talk about the digital health inclusion to achieve universal health coverage in the era of fourth industrial revolutions. Okay, so we are talking about the digital Bangladesh, where our Honorable Prime Minister said that service need to go to the doorsteps of the people. People will not go to the service. So in that context, in Bangladesh, we have a huge infrastructure development on digital health and as well as digital Bangladesh. And we have a huge internet growth. So I would like to show you here that you see industry academia collaboration is still in a very infant stage. So we need to have an industry academia collaboration, and this conference is the one where we can actually see how industry academia collaboration can happen. So you can see here, industry academia collaboration needs university and industry will work together. The responsibility of the university actually do the education, social responsibility, and do a lot of research, and that help the industry, and industry will acquire the talents and innovations. Both have a common goal to do the social impact. So in that context, I would like to show you that if universities are doing research and then solving the social problems and then commercialized, then pandemic is not a big deal. We can actually deal big challenges through the research and innovation. So with that keep in mind, in United International University, we developed AIMS lab, Advanced Intelligent Management Systems Lab, and this is our lab and the campus. So we work on the healthcare and disability. So here we extensively work on 4IR, how 4IR can help to healthcare and the disabilities. So I'm going to talk about very briefly on the healthcare. You can see this is the scenario of healthcare in Bangladesh, where you can see every hospital full of patients. And WHO is saying that if you can treat people in the lower facility, you can reduce the burden of higher facility, that is in the hospitals, right? So we have only 10 years left down the line to achieve SDG. So therefore, in AIMS lab, we did a research, what are the problems in healthcare and how can we solve the problems? So in that context, Bangladesh is a highly densely populated country. We according 2.5% of the population.
এক্সকিউজ মি, মাইক্রোফোন অফ থাকায় আমরা শুনতে পাচ্ছি না। মাইক্রোফোন অফ থাকার কারণে আমরা কিছুই শুনতে পাচ্ছি না।
Can you listen now?
Yes.
Thank
Yes.
you. Sorry for inconvenience. So now
Thank you.
I would like to talk about what are the basic problems of healthcare. When we think about the healthcare have 5 components. One is a preventive care, primary care, secondary care, tertiary care, and palliative care. Sadly, in Bangladesh, we only understand and focusing on secondary and tertiary cares. But we are not focusing on preventive, primary, palliative, and public health. And due to that, in our research in 2015, we identified 4 major problems healthcare in Bangladesh. One is non-communicable disease, like diabetes, hypertension, stroke, heart attack, which actually accounted 67% of the death, and premature death. We don't have a referral systems, health record, no health insurance, and as well as the 22% of the growth of the patient in a hospitals. So in a business-wise, it is great that every year more patient, more business. But when it considered the public health, it is a huge burden, and we have to stop it. So in that, I said that we have only 10 years to achieve SDG. So we have 4th industrial revolution technologies where artificial intelligence, AI will help us to actually address these problems. So that's why we are focusing on digital health ecosystem. As I said, that in the research lab, we are actually focusing on the solving the problems and take it to the industry. And if we can develop the digital health ecosystems where we have mHealth, wearables, big data, artificial intelligence, so that we can do the paradigm shift. Now our healthcare system is physician-centric. We are physician-centric healthcare actually getting. But if we do the paradigm shift, empower patient, then we can have a patient-centric healthcare. So it's a shift of the power. Then we can bring the transparency, efficiency, accessibility, and accountability. So with that, we actually did a research and developed a solution and applied for the patent, and we got the patent, and we actually commercialized. This is the first commercialized from the university research to the industry. This is CMED Health. CMED is a cloud-based medical system framework for rural health monitoring. So here we actually building a collaborative digital platforms for healthcare landscapes in Bangladesh to reach the last mile. So here just how CMED actually focusing to solving the healthcare problems. So here CMED believes to provide a platform which unlocks the individual potentials and build the society which everyone has the opportunity to live healthy, fulfilling, creative, and abundant life, both urban and rural areas. So how are we doing that? CMED is actually working to resolve the fragmented healthcare system in Bangladesh with lower cost and better healthcare service, and empowering both the provider and the beneficiaries. So here you can see this is a life cycle. When we see the life cycle, we have to have a healthy living. And in the healthy living, we have to do the preventive care. And even though we do the preventive, we can get sick. That's why we need diagnosis and treatment. And in the cycle of that, we can use AI, machine learning, to predict our future health risk, so that we can have a complete cycle of healthy living through the digital collaborative platforms, where government, NGOs, factories, our doctors, lab, pharmacists, future insurance companies can connect together. It's now necessity to connect all the health workers, doctors, hospitals, pharmacies, and everyone in one platform, so that we can connect them like an Uber. So here you can see that we have the beneficiary, we have a healthcare provider who is actually getting the service and then going to the further service based on their risk using clinical decision support systems, and then go there. Everywhere our data is there. So based on the data, we can have an AI-based risk prediction for everyone, for predicting their stroke and heart attack and so on. And we can actually build a data-driven healthcare. So using these platforms, we actually serving 1.3 million people in Bangladesh, and you will be happy to know that this is happened from the university to industry. So here we actually focused on few of the areas where in Bangladesh 65% cases people go to the pharmacy to get the medication, even antibiotics, which is malpractice. So we are actually established a smart Shastha Kormi model where the pharmacy will get the patient. If they don't have the prescription, they will connect to the telemedicine, and then immediately patient get the prescription and our pharmacist dispense the medications. And here we have a AI-based symptom checker to check the symptoms to assist the pharmacist as well as the patient. And on the other hand, we actually developed another model because antimicrobial resistance, that antibiotics, we are now in a COVID pandemic. However, in 2050, there will be a big pandemic on the antibiotics resistance. So AMR is a big issue. We actually developed a solution how pharmacy can help the patient to actually rightly intake the medications and completing the course so that we can actually prevent the AMR pandemic in 2050. So another is in Bangladesh, in our industry, 90% industry doesn't have the healthcare service. So with that, we actually serving factories through digital health corner service that every employee have the health account and they can get health services from our IoT-based AI-driven platforms and connecting to the healthcare resources. Next, in Bangladesh, we have 4,500 unions. Think about it. In every union, we have a union chairman. Union chairman is the political leader of that union or that catchment area. However, think about in that union, do you have a doctor? That doctor is responsible all the members of that union. So we keep in mind, we actually developed a GP model, general practitioner model, where a union have a one doctor, under the doctor 2 to 8, 9, 10, based on the size. We have like a health workers, paramedics, who can go to the doorsteps, do the regular health checkup. If they find any risk through the algorithm, they connect to the doctors and do the referrals. Can you play the video?
ধামরাইয়ের সম্ভাগ ইউনিয়ন হেলথ স্মার্ট হেলথ উচ্চ রক্তচাপ, ডায়াবেটিস, শিশুদের পুষ্টিজনিত সমস্যা সহ নানা রোগের প্রাথমিক সেবা পান রোগীরা। পিকেএসএফ, সজাগ ও সিমেড হেলথের সহযোগিতায় মাত্র 100 টাকায় একটি পরিবারের সবাই প্রাথমিক স্বাস্থ্য পরীক্ষার সুযোগ পাচ্ছেন বছর জুড়ে। আশরাফুল ইসলামের ছবিতে দেখুন মুজাহিদ শুভর রিপোর্ট।
ফেসবুক বা ব্যাংক অ্যাকাউন্টের সাথে পরিচয় থাকলেও খুব কম মানুষেরই পরিচয় রয়েছে হেলথ অ্যাকাউন্ট। যুগের পর যুগ জমা রাখা হয় একজন মানুষের স্বাস্থ্যের সার্বিক অবস্থার খুঁটিনাটি।
বছরে 100 টাকা নিয়ে একটা কার্ড দেয়, ওই কার্ডের বিনিময়ে মানে আমি 1 বছর চিকিৎসা পাই।
আমাদের বাড়িতে এসে আমাদের পরীক্ষা ঠিক করছে, আমার কোনো সমস্যা ধরা পড়ে না,
যাওয়া লাগে না কোনোখানে, বাড়িতে মাপা হয়।
সম্ভাগ ইউনিয়নের নবজাতক থেকে শুরু করে সব বয়সী মানুষের রয়েছে একটি করে স্বাস্থ্য অ্যাকাউন্ট। একজন এমবিবিএস ডাক্তার, 2 জন মেডিকেল অ্যাসিস্ট্যান্ট ও 14 জন স্বাস্থ্য পরিদর্শকের সার্বিক তত্ত্বাবধানে নিয়মিত ফলো আপ করা হয় সবার প্রাথমিক স্বাস্থ্য।
আমি যে গর্ভবতী, মানে ম্যাডামে বলে যায় যে এভাবে চললো, মানে সেইভাবে আমি চলাফেরা করি।
মেশিন দেওয়া আমার নখে ঢোকাইলো, ঢোকার পরে তারা মেশিনে মাপলো, মাইপে দেখে যে আমার ডায়াবেটিস আছে।
প্রেসার ধরা পড়ছে, ধরার পড়ার পরে হয়তো হ্যাঁ আমার নিয়ম দিছে, মাংস কম খাইবে কইছে।
পরিবারে যদি প্রেগনেন্ট মাদার থাকে তাকে আয়রন ট্যাবলেট দেওয়া হয়, অর্থাৎ দৈনন্দিন জীবনে যে অসুস্থতাগুলো আছে সেগুলাকেও আমাদের হেলথ কর্মীরা এবং ডাক্তার এটা দেখে এবং প্রয়োজন বোধে আমরা রিফারেলও দিই।
ডিজিটাল পদ্ধতিতে সবার অ্যাকাউন্ট পর্যালোচনা করে দেখা যায় এই ইউনিয়নের মোট জনসংখ্যার প্রায় 16 ভাগ ডায়াবেটিস, 11 ভাগ উচ্চ রক্তচাপ ও 25 ভাগ অতিরিক্ত ওজনের অধিকারী। এমন 10 ধরনের পরীক্ষার পর প্রতি মাসেই রোগীরা একবার প্রয়োজনীয় দিক নির্দেশনা পান ডাক্তার ও স্বাস্থ্যকর্মীদের কাছে।
আরও নতুন 20টি সেবা ইনক্লুড করব, যার মাধ্যমে মানুষ ঘরে বসেই ইসিজি, আল্ট্রাসাউন্ড ও অন্যান্য সেবা পাবে। মানুষ হাসপাতালে না গিয়ে ঘরে বসেই তার স্বাস্থ্য সম্পর্কে জানতে পারবে এবং তার ভবিষ্যতে হেলথের কি রিস্ক আছে সেটা সম্পর্কে সে আগে থেকে জেনে প্রতিরোধ ব্যবস্থা নিতে পারবে।
স্বাস্থ্যের ইতিহাসটা কি, কবে সে তার অসুখ হলো,
Okay, so you see that in that way, we can actually know the health condition of every citizen, and we can actually track all the information, and for the service delivery and tracking, we can know the everything here. So just I'm quickly just going through. So you can see, we based on the 51 unions and actually serving 1.3 million people, we actually developed a comprehensive model through a digital platform for providing primary and preventive health care. And this is a something game-changing model where $1 for a family for a month. We are trying to establish $1 for a family for a month, preventive and primary health care. If we can do that, we can easily achieve universal health coverage. So with that, I'm just going to show you that we are not only focusing on the rural areas, we also focusing on the urban areas. With the support from UNICEF, we actually established a GP model in urban areas in Dhaka North, Dhaka South, Narayanganj and Ghazipur. So this is a fully digital, for the first time in Bangladesh, comprehensive GP model in urban areas. So I just, due to short of time, I'm just quickly informing that the cancer is one of the biggest cause of death, and breast cancer on the top. So we developed first breast cancer screening protocol for Bangladesh, and I'm very happy to share with you that recently we completed clinical trial and we got 97% accuracy with 100% specificity and 97% sensitivity. So this is the first breast cancer screening protocol. We hope it will help and save a lot of lives. And we know that eye, in rural areas, a lot of people don't know they have an eye problem. We developed an AI-based eye screening protocol and virtual eye doc, and with that we can save many eyes in our country. This is the applications. Also, Parkinson's disease is one of the biggest neurological disorder, and we developed a Parkinson's screening protocol using machine learning and signal processing, and we got more than 90% accuracy. And then Alzheimer's disease. Alzheimer's disease is one of the biggest problem in a neurological disorder, and it doesn't have any treatment yet. So we developed a screening protocol that how can we know that someone have a Alzheimer's disease or not, and then we can connect them to the resources. And then autism is one of the neurodevelopmental disorder. We actually developed autism screening protocol. You can see I'm working on a lot of screening protocol. Why? It's early identification, early intervention to prevent many diseases so that we can save time, cost, and energy and resources. So also in our lab, we also working on there is a autism children who have a non-verbal, who cannot speak. We developed a solution, and that solution helped to actually enhance the speech of the children. And I'm happy to share with you all that few of the students, after using it, they never talked before, and now they can speak. And I'd like to share you 1-minute case study. One of the children, whose name is Monim, and who is 11 years old, who never speaks. But his hearing is fine, he is autism, and now he can, using this Boltechai system, he can speak and he go to the normal school. See the impact of solving social problems. So can you on the video, please? Just 1-minute video to show that how it works.
এখন বাংলা ক্লাস, বাংলা খাতা দাও।
আমি ডাক্তার খাদিজাতুল কোবরা, আমার ছেলে আশাব মনিম চৌধুরী। আশাব মনিম চৌধুরী অটিজম স্পেকট্রাম ডিসঅর্ডারে আক্রান্ত। স্কুল ফর গিফটেড চিলড্রেনে সে ভর্তি হয় মারফু আপার কাছে, এবং স্কুলে তার প্রথমে অনেক প্রবলেম ছিল। সে কমিউনিকেশন করতো না, কথা বলতো না, চোখের দিকে তাকাতো না, আই কন্ট্যাক্ট করতো না, কোনো কিছু ইন্ডিকেট করতো না। স্কুলে যাওয়ার পরে সে আস্তে আস্তে তার এই প্রবলেমগুলো সলভ হতে থাকে। আমরা বলতে চাই একটা অ্যাপস ওকে ইউজ করাচ্ছি। এই অ্যাপসটা ইউজ করার ফলে ওর ডেভেলপমেন্ট খুব র্যাপিড হয়েছে এবং এখন যেটা হয়েছে তার কনসেন্ট্রেশন ডেভেলপ করেছে, সে কাজ বুঝতে পারে খুব র্যাপিডলি এবং সে কোন কাজটার পরে কোন কাজটা করবে এই সমস্ত কাজের সিকোয়েন্সগুলো বলতে চাই অ্যাপসের মধ্যে ইনস্টল করা আছে। অ্যাকচুয়ালি এই অ্যাপসটা ইউজ করেই ও র্যাপিড ডেভেলপমেন্ট হয়েছে এবং ও এখন অনেক ভালো আছে।
So what we seen here, that these kids never speak at the 11 years old, and now he speak and he can sing a song. So see that local innovation and making bigger impact, and we just use the technology, nothing else. So like I would like to say that in COVID-19 last year, we worked with the government and served 2 million people for the COVID-19 support, contact tracing, and other activities. So we also developed the virtual ICU system for the first time in Bangladesh, and we are ready to launch for the commercial level. So in a nutshell, what I would like to say that fourth industrial revolution is a blessing for us. If we rightly use the fourth industrial revolution for solving our problems, we can actually solve the problems that I already said in the earlier, that we can have a health insurance, we can reduce the patient load, we can save many lives, and we can actually develop huge things in Bangladesh, and that could be exportable. We always import, we can export technology now. So as I said that we are already serving 3.3 million people and got a lot of recognitions, and I would like to share that this industry academia collaboration need to be enhanced and extended, and with that we actually build first medical engineering conference in Bangladesh, first neuroscience conference in Bangladesh, first deep brain stimulation surgery in Bangladesh, and this is the technological, our service is actually enjoying our governments, people, and our honorable Prime Minister as well. So a lot of recognition. I would like to finish with one of the quote by Dr. Devi Shetty. Dr. Devi Shetty, we know everyone that he said, in next 5 years, software will make smarter diagnosis than doctors, and it became a mandatory to take the second opinion from AI system, software system, before start the treatment. So what do we need? We need the data. So if we can develop the data, big data, and utilize the data, then Bangladesh will move forward, and we will lead 4IR technology-driven innovations, accelerations, not only in Bangladesh, around the world. And thank you so much for the opportunity, and we want to use technology to continue this smile. Thank you. Sarwar bhai, Professor Sarwar. Sarwar, is there any question from anyone?
I would like to request the audience, if you got any question, you can write in the chat box or ask the speaker directly.
Chat box open করুন তো।
It's not any question. Any questions coming from the audience?
I think one question came out from the chat box. Let me read through the questions.
Yeah.
Chat box, actually there is the valid questions, I think so, because
okay, I got a question, please.
Okay,
if you allow me to ask. Dr. Abdullah Mahmood, thanks for your nice presentation. Actually, this is very important talk regarding our healthcare system for Bangladesh. We really delighted to have your presentation. But like Bangladesh, if you'd like to have this, you have many examples put in there. If you'd like to put this type of example in Bangladesh, what type of policy do you consider the Bangladesh government can take for the people of the Bangladesh? If you kindly brief in a short, you can explain in a brief.
Thank you, Professor Sarwar. Thank you so much. This is a very important question you made, because that how this technological innovation can adopted by the government. So in that context, what we have the union chairman. That union chairman is there. But in Bangladesh, DG Health and DG Family Planning, they have a many infrastructure in the rural areas, but they don't have the coordination and technological adaptation. What we can do, we can utilize this model with the DG Health and DGFP and Ministry of Health to integrate the model to create 4,500 GP services in 4,500 unions. And in that way, Bangladesh will be the champion for universal health coverage before it achieved 2030. Thank you.
Thank you very much. Thank you very much for your, the nice answer to this question. Any other question from the audience? If there is no question, I would like to thank you, Professor Dr. Abdullah Mamoon, for his nice presentation. We look forward to have some other events in coming next 2 days and tomorrows, and after the event as well regarding industry academic collaboration. Please stay with us. That has been running virtually and physically from BICC. Thank you very much, Professor Dr. Abdullah Mamoon, for your nice presentation.
Thank you so much for listening. Thank you.
Thank you. I would like to request the audience to stay online, and we're going to have another session starting right now on the same line.
Honorable Papan sir, may I leave? Yes.